last time when we spoke about heart diseases in Kashmir, its prevalence, what are the risk factors, and why is it predominantly seen in obese and people with other comorbid. I already introduced myself. I am Faik Bhatt. I am a medical student in Delhi, and today we'll talk about national or perhaps a global issue of diabetes. In medical terms, it's known as diabetes mellitus. First of all, we should know what diabetes is, what causes diabetes. In simple terms, whenever we eat any carbohydrate, contains natural sugars which are digested in body. The sugars are released into the bloodstream, and the sugars are then utilized by the cells of body, such as muscle cells and any other cells, any other tissues in the body which require energy. Of course, every cell in the body requires energy to survive and do its functions. Why is it a problem that if larger or more than average values of blood glucose is seen in an individual? Why is it a problem? It is a problem because it causes other issues such as heart problems, kidney problems, problems of the eye, and of course later on problems with the other structures of the body. Point is, now we have already discussed what diabetes is. Now let's go into its types. There are majorly three types of diabetes. Although there are other types as well, we need not to go in there. So there is type 1 diabetes, type 2 diabetes, there's gestational diabetes. There is diabetes 1.5 as well, all that stuff which you don't need to know. Diabetes type 1 is a type of diabetes, or it's a disorder of blood sugar elevation, in which of course blood sugar is elevated. Why does it happen? It happens because the beta cells which are in the pancreas. Pancreas is an organ inside the body of a human which produces hormones like insulin, glucagon, and particularly beta cells. They are responsible for production of insulin in pancreas. What happens in type 1 diabetes is that these beta cells are destroyed by the immune system of the body itself. What are its causes? Autoimmunity, genetics, and other. There are other things which also play a role in causing of this disease. Type 2 diabetes is a type of diabetes which which is usually seen in adults. Type 1 is usually starts, develops in childhood, goes into adulthood, and then stays with you lifelong. There is no cure. There are treatment modalities available, but no proper cure for diabetes. It is insulin dependent. You need insulin being injected into the body of the patient. Type 2 diabetes, it's a kind of a diabetes which develops in adult. It's not something which is only seen in adults. It can also be seen in young people. But for the general population, type 2 diabetes is seen in older age groups. What are its primary causes? Obesity is one of the very major causes of this disease. Increased use of junk food, no exercise. As I said, sedentary lifestyle. Minimum 140 minutes per week body exercises are required for a healthy lifestyle, which is not asking for much. 140 minutes per week. So diabetes, it seems like a harmless thing that if blood which is carrying blood sugar, which is carrying sugar, glucose, for a certain period of time, for months and years, it carries a little bit more. What will happen? Surely seems like harmless. But in the long run, it is seen that high levels of glucose in blood causes renal damage, it causes liver damage, it causes retinal damage, could cause blindness as well. You could literally be on dialysis. Your liver could be damaged to an extent where you will develop edema all over your body. Literally, this is a death sentence if not properly looked into, properly treated. Let's talk about the symptoms a person would develop if they had diabetes. Frequent urination, thirst, rapid weight loss, sensations in the sole of the feet. All these symptoms are could be the clinical features of this disease. This is how this disease manifests in an individual, in a person. So, who are at more risk of developing this disease? The people who are obese, who live a sedentary lifestyle, who do not exercise, who do not walk, These are the people who have other comorbidities, hypertension, heart disease. Well, in fact, this can in turn cause heart disease and other diseases like stroke as well. This diabetes can cause all those things. So, how do we diagnose it? Simply, what people usually do nowadays is they go for HbA1c. What is HbA1c? Is a diagnostic test which measures average blood sugar. People say for 6 months, but it's not actually true. It's 2 to 3 months only, not 6 months. So if the values come less than 5.6, it's normal. There's no diabetes. Values come from 5.6 to 6.4, I guess it's pre-diabetes. What is pre-diabetes? Is a condition in which you do not have any clinical manifestations of the disease, but if the levels deteriorate further, you will develop the clinical manifestations of the disease. So if levels are over 6.4, it's diabetes. But it's not a gold standard is still fasting glucose levels of the blood. There is other test which is called glucose 2-hour glucose tolerance test. You need not to know about that. Fasting glucose, random glucose. If we go for random blood sugar, it should be less than 200 mg per deciliter. If if they come above 200 mg per deciliter, it has to be accompanied with clinical manifestations like frequent urination, sensations in the feet, rapid weight loss, there could be thirst. These clinical manifestations, clinical features should be accompanied along with random blood sugar valued above 200 mg per deciliter. Fasting glucose is another parameter which is actually used to determine whether a person who has been fasting for 8 or more hours, what is the value of their blood sugar after fasting. It is usually less than 100 mg per deciliter. It's normal from 80 mg per deciliter to 100 mg per deciliter. If it is above 120 mg per deciliter to 126 mg per deciliter, it is considered this condition is considered to be pre-diabetes, pre-diabetic condition. Now, if the values come above 126 mg per deciliter, it is diagnostically confirmed diabetes. You do not need the clinical manifestations. You need these clinical manifestations in case of random blood sugar, which is like the levels you check in levels of blood sugar you check in an individual when he's not fasting. So these are some of the diagnostic criteria, diagnostic features, which are diagnostic tests or diagnostic values which we use to determine whether a person is suffering from diabetes or not. So why should we bother about diabetes? As I said, diabetes does not come alone. Diabetes brings along with itself diseases such as which affect heart, which affect kidneys, which affect lung, which affect liver, which affects the brain, the eyes. So therefore, it is a disease which needs to be looked into. So, how do we prevent this disease? No junk, low levels of sugar in your food diet, exercise, blood sugar monitoring. Those people who are susceptible to these disease, who have a familial history of the disease, or those people who are obese, they live sedentary lifestyle. All these people are at risk of developing this disease. So simply exercise, screen, monitor your blood sugar levels, especially if you are a hypertensive patient. You have to monitor your glucose levels. So I would like to emphasize on this matter once again that many of you, especially back home, people usually when they are pre-diabetic, they usually what they do is they go to these laboratories where they get these tests done, and then that guy who is running that laboratory tells you that it's normal, 126 below, it's fine, doesn't matter, you won't have any issues. But medically, it is a problem. You might have to start medications in order to stop further progression of this disease. You are still a pre-diabetic, you do not have the clinical features, but if you do not take the medication, which if prescribed by a proper licensed doctor, this disease will not progress into proper full-blown diabetes. So stop listening to all these quacks who are not qualified. Let them do what they are supposed to do. And also, I need to emphasize on this that please get your tests done from a proper certified standard laboratories. Everybody knows the names. I don't need to take names. And also get the get your medical advice from a proper qualified doctor, not anybody, not just any quack. So yeah, early detection, screening, screening for complications, looking for the symptoms and all. These are some things which you should keep an eye for. And very important that if you are an old obese person in a sedentary lifestyle, you have to get screened for the disease, get your HbA1c done, or random blood glucose levels. You will get an idea where you stand with respects to diabetes mellitus, sugar disease, which is commonly known as. I hope I was able to give you some information about this disease, which is a global issue right now because of prevalence of junk food, sedentary lifestyle, obesity, and factors such as stress and other factors which affect the human, and diabetes is among one of them. So I hope I was able to explain it to you somewhat. I would like you guys to provide me with the feedbacks where I can improve and where I can be of some help to you guys.